Bismillahirrahmanirrahim. Assalamu alaikum students. In the last lecture we discussed about different milestones of motor development in the first 2 years. We also studied about motor development in early childhood. We discussed about milestones of gross and fine motor development from age 2 to age 6. We also talked about motor development in middle childhood. Now we will discuss about physical development over time. Differences in physical growth are apparent from everyday observations of people around us. And we differ in terms of height, in terms of weight, the relative length of our body proportions, and fitness. So everything is different. We also differ in our abilities to move and perform physical skills and tasks. So there are differences. And these differences provide valuable insights into our maturation, overall development, and health. So these all differences are important to know. And these all differences are important to consider when we are teaching. Now we will discuss about physical development in infancy. During infancy, changes in the nervous system are extremely rapid. And during infancy, bones increase in number and density. So this is also an important aspect of the physical development. Muscle fibers become larger and contain less water. During this period, stamina improves as the lungs grow and the heart gets stronger. So this is also an important milestone. Motor skills improve rapidly in the first 2 years. We have talked about motor development in the previous lecture, and we discussed about this that during infancy, the motor development is very rapid. A child is, learning gross motor skills and fine motor skills. During this age, sensory and perceptual skills also improve. So, color vision is present at birth, but visual tracking skills are relatively poor at birth and then develop rapidly during the first few months. Basic auditory skills are more fully developed at birth. The newborn can locate at least the approximate direction of sounds. The sensory capacities for spelling, tasting, or smelling anything, and the senses of touch and motion are also well developed at birth. And if we talk about the perceptual skills, the visual attention appears to follow definite rules, even in the first hours of life. Babies can discriminate the mother's face from other faces and mother's voice from other voices. And this is really surprising. From the beginning, babies appear to attend to and discriminate among speech contrasts present in all possible language. Interestingly, studies show that infants can learn something via one sense and transfer it to another sense. Babies grow 10 to 12 inches and triple their body weight in first 2 years of life. A 2-year-old's height can be reliably predicted by doubling his or her current height. A newborn's muscles contain a fairly high proportion of fat. By 1 year of age, the water content of an infant's muscle is equal to that of an adult's, and the ratio of fat to muscle tissue has begun to decline. Changes in muscle composition lead to increases in strength that enables 1-year-olds to walk, run, jump, climb, and so on. Now see some important features of physical development in early childhood. Physical development is slower from age 2 to age 6 than it is in infancy, but it progresses steadily. So in the previous slides, we discussed the physical development is very rapid in infancy, but in early childhood, it gets a bit slower, but it is stable. There are rapid neurological changes. This is important milestone. Motor skills continue to improve gradually with marked improvements in gross motor skills, for example, running or jumping, and slower advances in fine motor skills. We have talked about this in our previous lectures, that during this age, children are trying to use their fingers, use their hands, but their movements are not very accurate. For example, they are trying to use scissors, but of course at this stage, they cannot cut with accuracy. And further, children's drawings evolve from simple scribbles to complex compositions that includes several objects. So the drawing is also improving. So these all things are included in physical development in early childhood. Now see the physical development in middle childhood. Physical development from age 6 to age 12 is steady and slow. Major brain growth spurts occur in 6 to 8 years olds and in 10 to 12 years olds. So these are the periods that there is a major brain development in a child. Neurological development leads to improvements in selective attention, information processing speed, and spatial perception. So during this age, a child is improving in paying attention and the process of information processing, and all these things are, developing at this stage. Then we have discussed about this in our previous lecture that there is a large muscle coordination. So at this stage, large muscle coordination continues to improve at this stage. And further, there are all improvements in fine motor coordination. At this age, the children can perform these tasks with accuracy, with confidence. So these are very basic and main points of physical development in middle childhood. Now see the physical development in adolescence. In this stage, the brain continues to develop. The brain is continuously developing, and there are two major brain growth spurts. The first between ages 13 and 15, and the second between ages 17 to 19. So this is a time that your brain is developing very rapidly. And there is increase in muscle mass and in fat. So you can observe that children are growing up now. They become healthy. They have increase in muscle mass. They increase in fat. So these are, different differences, and you can observe that when a child is, becoming an adult, so what happens? He increases his height, he increases his weight, he increases his body fat, and his muscles are now stronger. Puberty is triggered by a complex set of hormonal changes. So this is a time of hormonal changes as well. An adolescent may grow 3 to 6 inches a year for several years. So you can see that there is a process of growth, but that process is little bit slow now if we compare with infancy. During the teenage years, the heart and lungs increase considerably in size. So this is the time when in teenage, the heart and lungs increase and they become stronger. Now look at some important aspects of physical development in early adulthood. In this age, the brain reaches a stable size and weight in early adulthood. So this is the age that your brain is on its stable size. There is strong evidence that at least one spurt in brain development occurs between ages 17 and 21, and the second one in the mid of late 20s. So this is the time that your brain is developing. Adults are at their peak both physically and cognitively between ages 20 and 40. So this is a time of peak. In these years, a person has more muscle tissues, greater aerobic capacities, more calcium in the bones, and a more efficient immune system. So, generally, we discuss that a person is at his peak. Peak in both senses, physically and cognitively. So, between the ages of 20 to 40. So, this is the time that you have grown up and you have all these capabilities. You have aerobic capacities. You have more calcium in your bones and you have more efficient immune system. Now see the physical development in middle adulthood. So here are some important points. First of all, middle-aged adults often outperform younger adults on everyday tasks that require concentration and rapid judgments. For example, driving. But on the other hand, their brain size diminishes a bit in middle adult years. And bone size also declines. So this is the time, middle adulthood is a time where different things are, declining. One more important thing is that thickening of lens of the eye, accompanying loss of elasticity, reduces visual perception. And there is also hearing loss at this stage. So, but at this stage, this is a bit gradual. So maybe at this age, you have weak eyesight or hearing problems and things like that. But overall, you perform better where concentration is required and rapid judgment is required. Then look at physical development in late adulthood. Researchers in this field group the elderly into three subgroups. The young olds between 60 to 75 years of age, the old 75 to 88 years, or in some places 75 to 85 years, and the oldest old, 85 and older. So this is a general, grouping. And there are changes in brain which cause slowing reaction time for almost all tasks. So old people are performing their task, but these tasks are very slow now. They are trying to do all the activities, but they take more time to perform those activities. They take more time to do those activities. And there is loss of hearing and overall decline all body functions. So you can observe this, that in this age, your functions are declining, your body functions are declining. So this is the age that you are, decreasing your capacities. So these were some important features of physical development over time.